Hey everybody.
Welcome to a bonus, very special Utah AF. We need the NBC little the more you know star thing.
Dun, 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 dun.
Jill, tell everyone what you're doing.
Well, I'm quite literally right now injecting myself with Dilaudid. If you're listening to this, I just pushed a little green button and it's a PCA pump, patient controlled analgesia. I can't talk. And why am I doing this? Because I just had surgery today. I made the decision to have a prophylactic mastectomy. And if you're not in the medical field, that means they remove your breasts preventatively.
Or in other words, you get your pineapple spliced, as we said last night.
Or sliced. Yeah. I did get my melon sliced off today and then filled with some silicone melons.
So how does it feel?
Weird. It's sore. The hospital has been, as you know, we are in the middle of a pandemic and the hospital is very full.
I thought that was a conspiracy. My friends say that it's all fake.
Yeah, your friends are idiots. But they were supposed to discharge a whole bunch of people today, and it just didn't happen by the time I was going to get my room assignment after surgery. And so I'm at the very end of the hall in a negative pressure room. And so those are the rooms that they usually leave for people that have COVID or an infection that's airborne, or had droplets. They usually leave those rooms. So if I end up being in the hospital beyond tomorrow, they will likely clean this room and put me into a different room and save this room for someone that has a greater need for it than me. But it was the only room that was available on the surgical floor.
So you mentioned discharged. Speaking of discharged, how do they discharge your breasts to remove them?
Well, Jake, I'm glad you asked.
Are you?
No,
Are you glad
but
I asked in that way?
no. So last night I could not fall asleep. Usually, like, I don't have that. I get anxious before surgery. I always have, but I don't get to this point where I can't sleep. Like, I even took an Ambien last night trying to go to sleep, and it worked for 2 hours. But I had to be here at the hospital at 6 a.m. this morning. So anyway, they were like, wake up, make sure you set an alarm so you can wake up and drink at least 20 ounces of water so that we can get an IV started, because IVs are really hard to start when you've got dehydrated veins. And so I set an alarm for 3 a.m. and I was like, okay, I can do that. Because I was like, if I do that, then I can just chug some Gatorade and we'll be good. So I did fall asleep, and I'd maybe been asleep for 2.5, 3 hours. And I was wide awake right before my alarm went off, and I didn't go back to sleep. It was like, oh, F this noise. and I haven't been back asleep since I've been awake out of the recovery room. I have this really weird situation. Like, I'll get back to where you were where point of my story, but I get this. I'm one of those weird people that like pain medications do the opposite, have the opposite effect on me in the beginning. Like, they make me really hyper. Um, and it's like Benadryl makes me crazy hyper. It doesn't make me tired. It just makes me hyper. And it's awful. It is the worst curse. It's just, it sucks so much.
It's all tit for tat.
I see what
Get
you
it?
did there. But what
Yeah.
I was doing while I couldn't sleep last night, I decided to see if how they do a mastectomy on YouTube. If it had been updated since the last time I worked in an operating room.
Huh.
And it has been cleaned up, actually. I was kind of impressed with the technique has changed. It it's gotten prettier. I'm sure there are still some surgeons whose skill is less, you know,
You didn't look this up on Dr. Phil's channel, did you?
no,
Because he's
because
not that kind of doctor.
no.
We're gonna do a mastectomy, everybody.
Dr. Oz isn't that kind of doctor either.
No.
He's a cardiologist. Did you know that?
Is he
Or a
really?
cardiothoracic surgeon. I don't think he works though anymore. He's
Who's
just,
quackier, Dr. Phil or
oh,
Dr.
he's
Oz?
crazy. I honestly think Dr. Oz is quackier. Dr. Phil just isn't licensed. But Dr. Phil's not a medical doctor, but he's not a licensed psychologist anymore either.
So don't get a
Anyway,
mastectomy from Dr. Phil.
yeah, or Dr.
Please don't.
Oz.
Not that they would offer, because they're both great people.
Okay,
Wow. I'm sure they are.
probably. But anyway, so yeah, I watched this procedure because I was like, I also wanted to know how I know how they do a mastectomy, but I've never watched them do a reconstruction right after. And how do they do it with implants? Like, I didn't know how that all took place. So, as I mentioned on the show prior to this, I decided to go quite a bit smaller. Always had quite large breasts, and yeah, I just have always hated them. I just don't. I've always just had a negative kind of everything about breasts have been negative to me because I think it's just because my mom was sick and it was her breast that made her sick. And so in my child brain, that's what it did to me was mom got sick because of her boobs. So I have the fact that mine were gigantic, always in everybody's face. Well, not really because I'm
Maybe if you were
4'11".
taller.
Yeah, you know what I mean. Okay. I just really
Short
hated
joke.
them. I
Yeah.
hated them. So after I had this last biopsy in uh, December, I decided that it was time to take care of this problem permanently. And so I watched it. I watched this surgery last night, and it was interesting. It wasn't quite what I was hoping for. I really wanted to see how they did it, but it was more of just kind of a dumbed down version for people. Also, I think most people would get grossed out by it. So,
Yeah.
but I I decided this morning that I didn't, the doctors kind of went over surgical plan, double check everything, you know, at this point, I think this morning we 20 times checked it. We've had this discussion a few times, my docs and I, but in the pre-op areas where they draw the markings, where they are gonna cut the incisions and everything. And so today was the decision, are we gonna keep the nipples or not? And so this is something I've been doing research on. And I made the decision not to keep my nipples for a couple reasons. The biggest reason for me was because ductal cancers, breast cancers, are generally the most genetic ones are going to come in the ducts. But if you're going to take away your breast tissue and do a preventative mastectomy, why wouldn't you just take away all of it? And that's how I went into this. The other issue is when you're removing a whole lot of tissue, the blood supply is not very good, and trying to rewire the vessels there afterwards would have been a pretty, it would have been tricky. And they do have medical grade slugs that they use, or silver, or they can use nitroglycerin cream to help stimulate blood flow. But that's just not something I really wanted. So maybe in a few months, we'll probably get some nipples made, or we'll tattoo them on. If I decide I want them, we'll do some 3D tattooing.
That would be a fun job.
Tattooing nipples on
Yeah.
mastectomy patients.
So what do you do? I'm a nipple tat artist. Nip tat.
There's a lady that I follow on Instagram who is so talented. I need to find her, but anyway, because I can't remember her name, but she's based out of LA, and you cannot tell unless you're looking from a side view that these nipples are flat, that her areolas are flat. They are so perfect, and it is just amazing. And I'm like, that is maybe where I'll want to go to do this, because I don't think I really want to I don't want nipples, like nipples built, because then they always would look cold. Like they're always going to be pokey outy.
You know what? I think I would just swing the pendulum the other direction and just get the fembot nips. You could
Just
load up and
Fembot,
shoot at
Austin
people.
Powers it.
Yeah, it's a self-defense. That'd be cool.
This morning, I asked Curtis, I'm like, well, do you want to kiss him goodbye? And he laughed and he goes, no, but I do want to do this. And he comes up and he's like, I love my husband. You know, I love my husband, right? We've all established I love my husband. He comes up and he honks him, and he makes this old timey car horn, Aruga honk. And I'm like, well, nothing sacred.
The arugula car horn is going to be more like an old-timey bicycle horn.
Yeah, that is actually what it is.
Yep.
That's very well done, Jakaroo.
The motorboating's going to be a little difficult. It's going to be like putting your boat in on the dry shore.
Silicone's buoyant, I think.
Ooh.
I don't know.
It'll be like motorboating on the smooth Great Salt Lake.
I don't know. My boobs have never been this little, so it's going to be a new experience for all of us.
Good times, good times. Well, if you're feeling low, I'll sing you a song.
Okay.
Just picture me singing this song in your head.
Okay, sing.
Remember the 80s?
I remember the 80s.
Remember Top Gun?
Yeah.
Take my breasts away. Dun dun dun. Dun dun dun.
Ow!
Dun dun. Take my breasts away. Okay, I don't want you to.
It's funny, but it hurts
Don't
to
laugh.
laugh.
Don't laugh. I
Oh,
didn't.
I sound like an emo kid. It hurts to laugh.
I
All
don't got
right.
no boobs no more.
I don't got no boobs.
But
Lieutenant
Lieutenant
Dan.
Dan, you don't got no boobs.
All right, guys. Well, I just wanted to check in, and I do want to give a shout out to my co-host here. Jake has been really supportive of this, and like the amount of support from my friends and um, especially my husband has been so amazing, and I just appreciate it so much. So thank you, Jake. I
Yep.
appreciate your friendship, and just you've seen kind of a lot of what how breast cancer has affected my family and me. I met you not long after my mom died, and so this has been a long time coming. So I appreciate your friendship. So thank you very much.
Of course, and good on you for making the bold decision to do what you need to do.
So, all right, guys, we'll check in at some point later.
All right. Have a good night.
You too.